There was a lot of effort to persuade governments to honor the principle of nothing about us without us, and persuade all the various stakeholders that having people with disabilities at the table was really important, having them be part of the advocacy, having their voices heard. And I think in a number of ways that is now a given. And I think that's amazing to see people with disabilities do have a voice much more than they did before, sort of globally. And they do have a seat at the table, which I think is really good.
What impacts have you made towards the disabled community, either domestically or internationally, that you are most proud of during your time at the Human Rights Watch?
Well, it's been really amazing to see impact we've had in so many different countries. One of the projects that I was personally involved in is work on shackling and other abuses against people with psychosocial disabilities or mental health conditions in Ghana. And there we've seen one camp end the use of shackling, where one spiritual healing center that had held more than a dozen people in chains, for some of whom were there for nearly a decade. And just about a year ago, they also announced a national ban on shackling, which was the result of our in Indonesia, where we've also undertaken work on this same issue of chaining or shackling people with psychosocial disabilities and abuses in psychiatric hospitals. We've seen real impact in the way the Indonesian government has moved forward on including mental health care in its primary health care, training healthcare workers across the country. 25,000 health workers have been trained. And it's been a really important effort within the government to ensure that people have access to mental health care or psychosocial support. That's just one aspect of the work. We've also done work on access to education and seen some real progress forward in a number of countries where schools have begun to include, or donors, even more importantly, perhaps, begun to make sure that their funding does not discriminate against children with disabilities in schools. We've done work on people with disabilities in humanitarian crises, and seen that there's been a growing attention to this group as an at-risk group when it comes to conflict and crises around the world. And then the final area that we've done a lot of work on is on deinstitutionalization, where we're beginning to see more and more governments develop plans to move people out of institutions and into communities with the support that they need.
I think it's so crucial to tell these stories. They are really hard to read and they are really hard to research, but I think especially a lot of us living in the U.S., both with and without disabilities, we don't realize how far behind third world or developing countries are in terms of disability rights, and how important it is to continue the work both domestically and internationally. So I understand the density and how emotionally taxing it can be. So how has disability rights work changed how you view or treat individuals with disabilities? Compare from before you started this work and how the disability rights advocacy work has changed you over the last decade?
Well, I think at the start of my engagement in this field, there was a lot of effort to persuade governments to honor the principle of nothing about us without us, and persuade all the various stakeholders that having people with disabilities at the table was really important, having them be part of the advocacy, having their voices heard. And I think in a number of ways that is now a given. And I think that's amazing to see people with disabilities do have a voice much more than they did before, sort of globally. And they do have a seat at the table, which I think is really important.
So going back. So I was asking that question in light of what is different compared to the global north and the global south. How is what individuals with disabilities in the global north need different from things that people need in the global south? How do they differ?
Well, I think it's hard to say because we just released a report this last week on access to education for kids with disabilities in schools in Brussels that are run by the European Union. And even there you have children with disabilities who are denied the chance to go to school with their peers. They're not given the support that they need. Of course, the scale is probably much less. There are many more children with disabilities likely in school in Europe than in places in the South, the global South. But so many of the issues are the same. And the scale just might be different, and the resources are, of course, quite different. But it comes down to, at the end of the day, I think the political will and the importance of treating every single person just like anyone else and making sure that they have their rights. And that the philosophy of that carries over from the north to the south, and frankly, as people with disabilities are denied those rights around the globe.
So we've heard about people with disabilities being hidden away, being locked up, being blamed for their disabilities from evils that they've done in the previous life or whatnot. These kinds of negative attitudes have existed for a very long time, for decades. What progress has been made to improve this mindset?
I think having people with disabilities in leadership positions really does begin to shift the thinking. I think people with disabilities are more empowered the more that they're educated, the more that they're in senior positions in government, in the private sector, in the entertainment industry, the more, and I think that's shifted to some degree, although there still is a lot to go.